It is indeed a pleasure to be part of this discussion. I wish to welcome the audience and the larger Howard University community and the environs. We are certainly at a crucial time considering this pandemic, and Howard University is indeed at the forefront. Today we have assembled a panel of individuals to address some of the things that Howard University is doing to address the COVID-19 pandemic. With us today is Dr. Terri Adams. Dr. Adams is a professor in the Department of Sociology and Criminology at Howard University, and she's also the Deputy Director of NOAA, the NOAA Cooperative Science Center in Atmospheric Sciences and Meteorology. She's also a member of the Howard University Initiative on Public Opinion, which has conducted national studies on the impact of COVID-19 in Black and Latinx communities. Dr. Adams's research takes an interdisciplinary approach to examining issues that have both theoretical and practical implications. Her specific research interests include emergency management, policing, gender studies, and the impact of trauma, disasters on individuals and organizations. We also have with us Dr. Carla Williams. Dr. Carla Williams is an associate professor of medicine and public health. Her research addresses issues of health equity affecting African Americans and other underrepresented communities with emphasis on cancer disparities. She provides leadership with Howard University research enterprise to facilitate collaborative, participatory research among scientists and between community stakeholders and academic partners. The third person with us today is Dr. Tamara McCants. Dr. McCants is originally from Brooklyn, New York. She received her Doctor of Pharmacy degree from Florida A&M. And during her 20-year career, she has been dedicated to increasing the capacity of pharmacists to be a major contributor in the achievement of favorable health outcomes, especially for the underserved population. She's currently the Director of Residency Programs and Practice Transformation at the College of Pharmacy, and she has been involved in responding to the COVID-19 global pandemic by caring for vulnerable patients and coordinating a major testing initiative. Lastly with us today is Billi Wilkerson. She is a 2020 graduate of the Howard University School of Law. Upon graduation, she was awarded the prestigious Charles Hamilton Houston Social Engineer Award for her pro bono service. Over the past 2 years, Ms. Wilkerson has worked with the Thurgood Marshall Civil Rights Center and partnered with human and civil rights organizations, including the Law for Black Lives, DC, the ACLU, and the US Network of Human Rights. Let's welcome our panelists. My name is Earl Ettienne. I'm the Director of Graduate Programs and Industry Partnerships here at Howard University's College of Pharmacy. Without further ado, I want to get to the panelists so that they can hear from you, the experts in the area. Beginning first and foremost will be Dr. Adams. Dr. Adams, I'd like to give you the stage.
Thank you. I'm just going to attempt to show just a few slides, just to share with you some of the research that we've been engaged in with the Howard Initiative on Public Opinion. Hopefully you're seeing the slides right now, correct?
Yes, ma'am.
Okay, awesome. So again, my name is Terri Adams, and I'm one of many different folks who are part of the polling initiative. So it is an interdisciplinary group of scholars. We represent the programs and departments of communication, economics, English, political science, psychology, and sociology. And so that gives us a broad range of ideas and theories and methods from which to draw from to do the work that we do. So we thought it was important to focus on COVID-19 this past summer. And of course, you know, it's dominated all of our lives. And so we thought it was an important initiative. And gratefully, Dean Williams also considered it to be vitally important, and she supported this initiative. So we conducted a national poll. It was a web-based poll. We focused on the African-American and the Latinx communities. We thought it was important to focus on these communities, although we know that other national polls include African-Americans and Latinx folks. It's often done at lower numbers, and so we get less variability with those results than we will with the results that we actually I'm going to share some of that with you today. And so we focused on those who were 18 years old and over, and focused on the social, economic, and mental health impacts of the pandemic on, again, African American and Latinx folks. We collected a total of 1,654 surveys within a 2-week period of time during June, the month of June this year. In terms of what the sample looked like, most of the sample were African Americans at close to 52%, and the rest of the sample characterized themselves as Latinx. About 18% of the sample both considered themselves to be African American and Latinx. Most of the sample were women, and most were between the ages of 18 and 45, roughly, about 83%. This sample overrepresents the educated population in these communities, with 37% being college educated, and an additional, 33% attained some college, and 30% had only attained a high school diploma. We were able to produce 2 reports, and we had 2 town halls, similar to the format that we're doing right now. The first highlighted the range of COVID-19 concerns among African American and Latinx essential workers, and the second highlighted the emotional and behavioral response to stress and the effects of stress on the African American and Latinx populations. So because we only have a limited amount of time, I'm only going to focus on just a few key findings, actually. So we found that 52% of the folks that we polled actually considered or would be considered essential workers. And of course, they include physicians, nurses, nursing assistants, and people who work in the service industries. Among that population, it was interesting that about 25% were either furloughed or laid off, in spite of the fact that they were considered to be essential workers. And I can answer questions about that later on, but there's a reason behind that. Most disconcertingly is that a sizable percentage of the unemployed did not apply for unemployment. So even though they were eligible for unemployment, they did not apply for unemployment. And many did not know that they were actually eligible to apply. Again, one of the important facts that we thought necessary to pull out was that 66% of the sample were reported being very worried about the well-being of their family and friends, followed by 54% had major concerns about their own personal health, and then 39% actually were very concerned about their job security. Now, looking at the same population, again, we asked a variety of different questions. 72% of the sample considered themselves to be either extremely or very informed about COVID-19 at that time, and over a third were tested. And again, it's significant to remind everyone that we're talking about the month of June. In regards to coping strategies, 45% of the sample reported just accepting it, just, identifying it as a problem, and accepting it as such. 47% relied on actually using some kind of faith-based approach to the situation, and 29% reported engaging in active coping strategies. And so that would be trying to gain some control over one's personal well-being and taking steps to kind of soothe yourself. So again, those were our key findings, and I can share more later as we move along if it becomes pertinent to the conversation. Thank you.
Thank you so much, Dr. Adams. I would want to certainly dig into some of that information later on. Dr. Williams, if you wouldn't mind giving us some remarks here, that would be very helpful.
Certainly. Good morning, everyone. I am here representing specifically the College of Medicine, but as Dr. Ettienne indicated in my introduction, working with a few of our large research enterprises, I also have the opportunity to work across the campus. And I think my opening remarks would really be to say that in response to the COVID-19 pandemic, as well as, what we've seen the world turn its attention to in relationship to social justice and specifically health justice in our case. We've really seen Howard bring its true best to the situation. So I've been able to observe my faculty peers as well as students, which you'll hear from today in other sessions, and how we're really using what we talk about in our educational processes and bringing that to bear on the real world experiences that people are having. Specifically in the College of Medicine, we have, and I'll just represent some of my colleagues' work here, we have investigators who were already conducting research in areas that related largely to health inequities and disparities, and they were able to use that as a platform to then turn a lens on COVID-19 specifically, but also obviously in the context of the broader social discussions. And so, for example, projects looked at mental health, as we know is a huge issue now, in addition to the stresses of the pandemic, the isolation that can occur. So we have faculty looking at that. HIV/AIDS has been a major research area for investigators at Howard for many years. And so the very special issues that individuals with comorbid conditions, health conditions might face with COVID-19, we have researchers that are addressing that. And an important piece was as we had to move into distancing, and then it became an issue of how do people continue to get the needed health care that may not even be related to COVID-19. I specifically work with our oncology program, and so we know that cancer would not take a break for COVID-19. And so one of the major areas that Howard Hospital moved forward, as many institutions had to do, was in telehealth. But I think there's some really important lessons learned in terms of how we've had to adjust what we do in our practice to really meet the needs of the communities that we serve. And we've actually identified new ways to serve. And telehealth has actually been a benefit for many patients. People will often, ask about the digital divide, but what I've seen directly in our oncology work is that transportation had been a critical barrier for many patients to come in for their appointments. And we had a lot of patients who missed appointments. And so with the ability to offer telehealth, we actually found that more patients were able to get those needed physician visits. And so, what I've seen come out of this, as I said, Howard has absolutely brought our best and brightest to the work. And we're actually seeing how we're now able to leverage these advances that were somehow forced upon us. But as we say, necessity is the mother of invention. And so we found ways to offer better than what maybe we would have thought about doing before this unfortunate incident happened. And then with that, I think an important piece that we can maybe get into in further discussion is how Howard physicians in particular and clinicians overall are being involved in the research to address the health impacts of COVID-19. And that includes treatment and what are the best and most evidence-based treatments that can be offered to populations, and as well, of course, prevention, which would also include vaccinations. And so we have researchers working in that area, and it's important to note that these are teams that include faculty investigators who are physicians, who are nurses, who are community health specialists, and importantly, who are ethicists. So I think it's really important to know that none of this happens, particularly at Howard, in isolation, that we have teams that are looking at these issues and pulling down the silos that maybe have historically prevented us from being the most efficient with the kind of care that we provide. And now that we see the benefits of how we can work together, we're seeing a lot of advances as well. So there's a little bit of silver lining there despite the great challenges that we faced in this country. So I'll stop there and we can have further discussion later. Dr. Ettienne, you need to unmute.
Mm-hmm.
I'm terribly sorry. Dr. McCants, if you would be so kind as to share your thoughts with us. I see you.
All right. Well, good morning, everyone. And first to the attendees, I want to wish you a happy homecoming. Thank you so much for joining us today. You know, Howard Homecoming has always been a highlight of everyone's lives in the East Coast. So, you know, I'm glad that we're able to do this forum in this way. So as Dr. Ettienne mentioned earlier before, I am a representative from the College of Pharmacy, and Howard's motto of "in truth and in service" is something that we take very seriously and we do almost every day. So within the College of Pharmacy, community outreach is a highlight of what faculty and students do all throughout the year. And so it is through that we were able to establish a medical reserve corps, which is an entity that trains volunteers to be able to respond to an emergency. A lot of times when we are training our students, you know, we train them for, you know, worst case scenario, right? But then the worst case scenario never really comes. But that's exactly what happened when it came to COVID. Everything that we were talking to the students about how to respond to an emergency, the work that we did in terms of community outreach to increase community resilience so that our most vulnerable populations are able to bounce back, we were able to put that in practice when the pandemic hit us. So because of our outreach in the community and our relationships in the community, we had a great relationship with the Department of Human Services, who service the homeless population. And as any of you can imagine, the homeless population was a very vulnerable population when it came to the pandemic. And I do have to publicly commend the District of Columbia for how they responded to the pandemic. We can easily see how we compare to the rest of the states in terms of rates and just containment. And I think part of it is how we responded very early. So the Department of Human Services reached out to the College of Pharmacy because they implemented a strategy to have their staff to do symptom checks for all of their people that were coming into the shelters. And because the staff was overwhelmed with that responsibility, they contacted us to help them to fill in the gap for them. And so we went ahead and trained the students to be able to identify symptoms for the homeless population. But before we can even get started, the activity shifted because, again, just like what you see in the movies, and for those of you that were around when we had anthrax scares and, you know, when 9/11 occurred, everything moved very quickly. So we trained for one thing, but then the next thing we knew, we had to put together a medication management service for the isolation sites. So what the District of Columbia did was that they took the homeless population that were either most vulnerable for experiencing deathly disease, or for those that have been exposed to COVID, that they sent them to an isolation site that was set up in about 4 area hotels in the District of Columbia. But while those people were being transported to the isolation site, they didn't have anything. They didn't have their medication, they didn't have their testing supplies, and they had chronic diseases that needed to be managed. And so as pharmacists, what we did was what we do best is ensure that those people got their medications. So we set up a makeshift medication management service in a hotel room for about a month until the Unity Healthcare was able to fully staff that establishment. And so again, we came in, filled in the gap, and when they were fully staffed, we stepped out. And so again, I think that Howard University, we don't just talk about it, we be about it. They were able to call on us, we were able to provide a solution to the problem, and it was a very, very impactful, especially for that vulnerable community. The other activity that I want to highlight, and you know, I do want to again recognize the national research and global work that my colleagues are representing here on a panel. And so what I am speaking of more is what we did in the District of Columbia. So our reach is local, regional, national, and global, as usual. But the College of Medicine, College of Dentistry, College of Nursing, and the College of Pharmacy collaborated to set up a community-based testing initiative in the basement of a church, Pennsylvania Avenue Baptist Church in Ward 7. And so we worked all together in the best effort of what you would call interdisciplinary collaboration to make sure that people that did not have access to testing had more access, increased access to COVID testing by setting up a testing site in a community church. And in that testing site, working together again with all of the colleges, we tested over 400 patients, many of whom were elderly, over 70 years old, that came in to the church to get tested for COVID. And so in that initiative, again, under the leadership of the College of Medicine, we were all able to work together. We all put together our roles. We had faculty and students that met every Tuesday and Thursday to run that COVID testing site before a lot of the other testing sites were set up. So again, as alumni, Howard should be, we continue to step up and just have the impact that we know that we can have. It's awesome.
Well, thank you for that awesome presentation. You see, ladies and gents, we have among us, stalwarts in the community. If I could then pivot to Billi Wilkerson for a moment. Billi, if you can give us your remarks.
Yes, good morning. Again, my name is Billi Wilkerson. I graduated from the Howard University School of Law in May. So I was a pandemic graduate. We had online graduation. And over the summer, I worked with the Thurgood Marshall Civil Rights Center, and we did a report called The Contradiction. I listed a link, I think, in the question and answer period. I'll be able to provide links to both the research that was completed, as well as links to like the articles about how relevant it became, because as the previous panelists kind of named, things escalated really quickly. Like it went from like a regular, moment to a completely different moment in time. And then that was compounded by the events following the death of George Floyd. And so several layered issues became to become more and more relevant. So the research that we focused on with regard to the COVID pandemic highlighted the fact that Black Americans were twice as likely to die from COVID than any other race, that 33% of the hospitalizations at the time of our report were Black Americans, despite the fact that we were 13% of the population. More than half of all the COVID test cases were, half of all the COVID cases were African American, and over 60% of the COVID deaths in the United States, just from a health front. But the report actually focused beyond just health. We also talked about the economic impact. We also talked about domestic violence and what social distancing and sheltering at home means in domestic violence situations, and how that has impact on the Black community. We also talked about policing, and that's the part that kind of escalated later on in the summer, because the report was written in May, and mass incarceration and incarcerated communities, and how the pandemic was impacting them. In fact, we had compassionate release projects that members of our team worked on over the summer as well, to try and get elderly people who were in jail and not a threat to society to be able to be released from jail during the pandemic. But just to highlight some of the more useful pieces of the report, I wanted to first of all mention that the report was completed in partnership with, I'm just pulling up the report really quickly. The report was completed in partnership with the Harvard Law School's Criminal Justice Policy Program and Law for Black Lives DC. Justin Hansford, who is the director of the Thurgood Marshall Center, is my boss and the person who kind of oversaw the process. And then Natalie LaRoche from Law for Black Lives DC also was one of the writers of the report. And Chindu Obiafome was the legal fellow from the Criminal Justice Policy Program at Howard, who were the authors. And then there was a program called there was a program of interns that worked over the summer to make that information accessible to the public and very quickly try to disperse that information to different groups, including Congress. We got a lot of information to Congress during really critical moments in time so that they would be more informed as they were putting together, and again, very quickly putting together COVID relief packets. And so we were directly in communication. And when I say we, I mean like Professor Hansford and different members of the team were directly in communication with members of Congress to try and address specifically the needs of African Americans. The title of the report was The Contradiction, because colorblind COVID relief during the pandemic doesn't suit the needs of African Americans. When you look at it without paying attention to the lens of race, then you end up underserving a community that needs to be paid special attention to, for all the reasons that the panelists ahead of me had already mentioned. So it was really important to kind of highlight those specific needs and to try and identify ways that the issues could be addressed more coherently and more to suit the needs for the demographic that we particularly serve in our communities. I think I'm going to save a little bit of my time for the question and answer period, but I just wanted to be able to kind of introduce the concept and give people the information to be able to follow up.
Awesome. Certainly awesome. So we've had before us here 4 very knowledgeable individuals bringing information to us. What we have now is a special treat for you. We have actually the provost of the university joining us for a moment. So we would like to give the provost a moment to address this panel. Dr. Wuta?
Good morning, everyone, and thank you, Dr. Ettienne. I don't know if that's a treat or if I'm just interrupting a great conversation that is taking place, but just wanted to pop in. I'm trying to participate in as many of these sessions as possible today, because this is outstanding work that our faculty and our students have been engaged in, and we wanted to make sure that we seized this moment to be able to assure that while the protests have been taking place since the summer, and we're all impacted by the issues related to systemic racism, we wanted to make sure that we created an opportunity to make sure there was a mechanism and there was a plan for us to move from protest to policy. And particularly as we're in the election season, regardless of what your political beliefs may be, I think everyone can agree that there needs to be change, and we need to be at the forefront of how that change is made and is implemented. So I want to thank each of you. Hopefully, once this panel is finished, you'll have an opportunity to join and participate in one of the other panels. There's a lot of outstanding information being shared, and I'm certainly grateful and thankful to each of you. And I've said this to the previous panel, but I really want to particularly thank Dean Williams and Dean Holly Walker for assuring that this conference will take place. And also thank you, Dr. Ettienne. And so I I just want to be a fly on the wall. You know, that we have flies in debates now, and I'm just a fly on the wall today, just to bring greetings and to say hello. And thank you.
Well, thank you, Dr. Ruta. I don't have any fly swatters, but so thank you very much. So, you know, getting back into this discussion, Dr. Adams, can you talk with us just a little bit more about some of the findings that your report came up with? We saw the percent of the individuals who were laid off, you know, certainly going extremely high. As a community, we tend to face the brunt of, you know, if the society sneezes, our community gets a cold. Can you talk a little bit more about what COVID-19 has done in terms of the employment stats that you mentioned earlier?
Sure. So, you know, like everyone else, you know, I've been glued to the TV, and so have members of the committee of the initiative have been glued to watching the reports that have rolled in about unemployment and such. And based on the numbers that we came up with, we were definitely surprised to see so many folks laid off in positions that were considered to be essential employee positions. One of the things that we've been able to discern is that while you might work in and be an essential employer or be employed by an agency or an entity that is considered to be essential at this moment in time, resources might be put in a particular area that would then render your job not that important at the time. So for instance, if you work at a hospital and you are part of a crew that might be responsible for a particular aspect of health that is not as pertinent at this time, your employment status might change. Also, for those who work with the elderly, the need to kind of zero in on it and just have a limited number of people interacting with the elderly caused some folks to lose their jobs in that area of the market as well. And I could go on, but I want to hear from some of the other panelists. You know, I want to pick your brains about some of the things that you've been dealing with. Some of you are on the front lines of this, you know, as doctors and medical care folks. And we also ask questions to that population. So I'm just curious to know how has that impacted you or or your staff or the folks that you know emotionally. And I'm sorry, Dr. Ettienne, that's just a personal interest of mine. And
well, I understand,
Okay.
and we want this to be free-flowing, where just we continue to get all of the information out there, because we want the Howard community to understand the richness of what we bring to the table. So we can certainly, you know, address that. I would go to Dr. Williams next in terms of really just responding to Dr. Adams's call, and then and I have a follow-up question for you.
So absolutely, thank you for raising that. As people may be aware, Howard, in terms of its healthcare enterprise, is not only for folks who are training to earn their terminal degrees, such as pharmacy, medicine, nursing, but also after they complete that credentialing, we have residency programs and fellowships. So these are individuals who are in advanced training. And so we really have to acknowledge the just tremendous job that our residents have done in our hospital enterprise, being on the front lines every day. Especially DC was hit hardest earlier on, as Dr. McCants noted, due to the response, we were able to stem the tide here locally. But during that initial response, there was a huge gear up to make sure that bed space was available, to make sure that intensive care was available, and then everyone trying to really learn the guidelines that we all saw rapidly changing, especially for clinical care and what was the best clinical care to give. So to your question, Dr. Adams, that in and of itself, I believe, was a source of stress, because you're in a situation where you personally may be at risk, although we have come to understand that, you know, PPE does work, and that could be another discussion we can have in terms of access to that. But in addition to that direct stress, the stress of trying to follow the best available evidence for practice and deliver the best care to patients. And our population is what we would call medically vulnerable. A large percentage of our patients are covered by publicly funded insurance. And so that means that there are income disparities that exist for our patients, which can have downstream effects. So people can come in sicker compared to other locations. And so making sure that that care was delivered as expertly and compassionately as possible obviously was a strain, but it was incredible to watch the clinicians step up to that and meet that challenge. But yes, I think, and we started having these discussions about wellness for our providers, and that's something that we cannot lose sight of.
I want to stay for a second on the wellness of the providers and what's happening with the families. Because we are on the front lines. Can you discuss just a little bit about what happens within the homes of those individuals who are the front line and how it's providing the care? How has that really impacted their ability to deliver care?
I can speak to it briefly, and I think Dr. McCants was there on site with folks, so she probably can speak to it more directly, but I can relay experiences that our nurses shared with us. So of course, you know, trying to implement best practices for risk reduction, which is the full PPE, but there were some initial gaps in terms of, you know, at the beginning, making sure that patients knew their COVID status before they arrived. I think everybody probably got a message from their healthcare provider. If you have any symptoms, you know, please call us before you arrive, but sometimes that information didn't get through. And so it was a stress for our providers to then find that they had a patient that they weren't aware of and then what to do. This was very early on. We've gotten much more information about that, and people have found their new normal with this, but early on it was a source of stress because now people say they're going home to family members who may have pre-existing conditions, and you know, just being watchful of what's going to happen again early on, not knowing the trajectory that the disease could take and what to watch for. So I think that was a significant source of stress. It wasn't just taking care of your patients and yourself, but family members and potentially extended family members. And of course, you know, we know that people couldn't go and take care of those other family members that maybe they had taken care of before. So there are a lot of sources of stress that I think we will learn more about, and how people manage that successfully in terms of their own, you know, personal well-being and resilience, if we want to use that term, but also where the gaps were. I think that's where the learning will occur.
Absolutely. Dr. McCants, being on the front line, working side by side with students as well as individuals in the community, being a very visible person in the District of Columbia and working in conjunction with the Department of Public Health. Talk to us a little bit about what that meant on the side of the individuals where they may not necessarily bring forward in the public, and how has Howard really been instrumental in this piece?
Mm-hmm. So let me just first say that being a professor at Howard, I had the luxury of opting into responding to the pandemic, where a lot of our colleagues had to go to work regardless. And as human beings, they're humans first. So they had to, you know, figure out their own fears and figure out how they were going to push through and still go to work. And I think one thing that the pandemic highlighted are that pharmacists are much more essential than, you know, many people thought that they were. But I think that as Howard University just continues to just lead the nation, we basically show people how it should be done. And I think that what we have shown as a university that is in the community is, especially as an HBCU, we have the responsibility to ensure that our most vulnerable populations are being tended to. And I think as an HBCU and what Howard University showed is that when no one else can or can't do it or won't do it, that we did do it. And so the fact that we did do it, we are able to show others how it can be done, how it's feasible, and how you get to make that type of impact, you know, with minimal impact to your own personal life, if that makes sense. It's just a sense of responsibility of what we have to do to support our communities as an HBCU.
So we have social justice, which forms the core of our existence here. Billi, as a student coming out in the recent past, you say you're a COVID grad. I mean, from your perspective, how has Howard prepared you for this response?
Well, Howard is a very, very unique and beautiful institution. I had the privilege of being able to work on the 150-year history of Howard's Law School, and so it wasn't until the 70s that it became that the law school moved off of the campus of the main campus. And so looking at the culmination of historical events and things that our ancestors have had to face before us, it minimizes the importance of what it feels like in this pandemic. The things that they had to go through in order for us to be where we are makes me appreciate the options that I have. People who graduated in the class before me, you know, my friends are like working, they're working from home, they're able to work from home. And then me, in terms of being in the social justice atmosphere, I also over the summer was working at the Washington Lawyers Committee for Civil Rights and Urban Affairs, and working with workers' rights, and just having to receive clients who are really, really, really struggling with not being able to work from home and not being able to have the luxuries that we've been able to experience, and not being able to be in safe spaces with their families, and like, so they're like, you know, the little, you know, baby in me kind of wants to fuss and complain about, oh, I had to like sit in my apartment and do, you know, study for the bar all by myself, and, you know, not be able to be in a study group, but the privilege that I'm experiencing and the beauty of the community that I'm a part of, and trying to be a part of a community that's trying to make the world a better place, has just been a beautiful experience. And so when I think about being a COVID graduate and think about like my, you know, my kids and having to deal with them working from home, and, you know, like the whole entire thing, it's a moment, but it's our moment. You know, this is our moment in history, and it's our turn to shine, and it's our turn to be a part of the Howard community that places a mark in history and does some things that we can really, really feel good about. And so this is my moment. This is my civil rights movement. This is my, you know, time. And so I'm excited. I'll be honest, I'm excited, and the controversy of it all just makes it all more worth it.
Certainly. So what we've seen here is a varied amount of things that come forth in terms of the Howard response. Howard, fortunately for the nation, continues to be at the forefront in terms of stepping outside the box and not being afraid to make the unpopular decision that would advance the community as a whole. I would want to bring to your attention the fact that Howard is leading an initiative with some other HBCUs with funding that was to deal with testing on some of the campuses across the HBCU continuum. Dr. Williams, can you talk just a little bit about that report that was just released?
I think I would defer that to Dr. McCants, and then I can maybe speak about some other upcoming initiatives that haven't quite been publicly announced yet. Dr. McCants, could you perhaps address that more directly?
Okay, so what I can speak about is, again, how the College of Medicine, College of Pharmacy, College of Dentistry, and the College of Nursing at Howard University collaborated to set up a community-based testing site in Pennsylvania Avenue Baptist Church, in the basement of Pennsylvania Avenue Baptist Church. So that testing initiative occurred in the summer months of July and August, and it was led by our East of the River Clinic, Howard University East of the River Clinic staff, namely Sabrina Brown, who was the practice manager. And so what we did was we took the setup that was done at the East of the River Clinic, and we recruited volunteers to provide testing on Tuesdays and Thursdays from 10 a.m. to 2 p.m. on Tuesdays and Thursdays during the months of June and July. Unfortunately, we couldn't continue the initiative until, because school was starting back and most of us were faculty and students, but the Benton Road site still continues to test every day from 8 a.m. to 5 p.m. At the East of the River site.
Okay, and Dr. Williams, the testing that's going on at Howard University now, so that employees continue to be whole, can you comment a little bit about that?
So for the employee side, and students, there are some students on campus, so there's various schedules that have been established for testing. And I believe one of the other initiatives that you may have been referencing is that among the HBCUs nationally, Howard is among one of the lead institutions that will be coordinating testing resources for other HBCUs. So I can't recall the group of HBCUs that we're specifically a part of, but there are basically hubs around the country, and institutions like Howard and a few others have been tasked to lead those hubs to make sure that the HBCUs have the testing capacity to safely return students, faculty, and staff to campus once it is deemed safe in their local areas. And so that initiative is funded by several philanthropic efforts to make sure that the testing resources are available. And then Howard is offering the strategic development to make sure that the rollout fully meets the needs of each school. So I think that's another way that Howard is leading among our HBCU sister institutions.
Mm-hmm. And just so that individuals are aware, the institutions that I believe Howard is leading in this effort would be Virginia State would be one, Coppin, Morgan State would be a third. I am not sure of the others, but those were the three. Terri, if we can come back to you, Dr. Adams, for just a couple seconds, and talk a little bit about the polling. What has in your report, were you able to tease out the numbers by ethnicity? So we have the Black community. What are the similarities or differences we see within the African-American community as well as the Latinx community? Can you talk a little bit about that?
Yeah, so we asked a variety of different questions, so I won't focus on any particular question, but just in general, I can say that there were a great deal of similarities between the African-American and the Latinx populations in regards to the various questions that we asked. I want to highlight that, that among the Latinx population, most reported either being from Puerto Rico or Mexico. And again, most of their concerns, there were very few differences in regards to their concerns as it relates to the African-American concerns.
Okay.
Mm-hmm.
Oh.
The only issue I would say that really showed significant difference was the awareness of the ability to apply for unemployment.
Yeah. Can you tell me?
The Latinx populations were less likely to apply for unemployment and less likely to be aware of it being an option. And of course, you know, depending on, we didn't ask detailed questions about anything related to being of Latin descent that could provide us more detailed information about that. But we can look to do that as we move forward.
If anyone has a question in the audience, if you can use the Q&A section and put your question in, and we can certainly get to that question. There was a question that came up, and this would come right back to Billi. Billi, there was a question talking about the research that was done and how you brought information to Congress during that time. Can you expand a little bit about that? They were looking more for information surrounding the deaths within your report.
So we provided an educational resource to Congress. I want to be careful about the way that I language that, because we did research and we provided it and we supported that research. I did, in the answer section, provide the link that I mentioned. At the bottom of that news article by Misha, it links to the COVID report, and also on the Thurgood Marshall website, there's a little part that says contradiction so that you can look at the report itself. So what the researchers did is and again, it was Law for Black Lives DC. I want to make sure that I always say it correctly. The criminal justice policy program at Harvard Law School and the Thurgood Marshall Center together, and those people did the actual research and got all the statistics and compiled all the information, and then we as a group of interns actually all shared that information with other organizations. And so your question is about how we bring that research to Congress. Is that the question?
They were, I guess, looking more at the specifics as how they were looking at the data associated with the research that you brought to Congress from a death perspective. What stood out from the number of deaths that you were seeing in the research?
Mm-hmm. So the statistics that I cited, and yes, there was a specific comment about that in the comments. That was, and what the question was it really 60% of the deaths that were attributed to COVID were African Americans? And at the time that the research was completed, which was late May, early June of 2020, then that statistic was correct, and the citation is included in the report itself. Those numbers are changing, as all of us are aware, every single day. And it's still a very critical issue, and it's very, very important for Africans and African American communities it's just important. It's just important because of comorbidity. It's important because of all the reasons that were mentioned by the previous panelists. But if someone wants to look at the specific research, my recommendation is to go directly into that link, and the report itself is available, and all of the citations for everything that's provided is also provided in that report. And the best part about that is that because the information changes, the CDC actually, after we did our research, the CDC specifically gave statistics regarding African Americans in their publication. So if you go to those links and see what's updated under those links inside of the citations, then you'll find the most up-to-date and accurate information. Because again, it's changing every single day, and our lives are being affected every single day.
Absolutely. I just had a follow-on question for Terri. And while I do that, Billi, if you can take a look at the question that's in the Q&A, and then I'd want you to respond to that live for a second. Terri, when we see the mix of deaths, similarities between African American, similarities between Hispanics, Howard at the forefront, what would you say from your perspective, your vantage point, has been the biggest takeaway in Howard's response?
Well, I think the panel has demonstrated that we've been active from a variety of different areas of specialty in addressing this. And we haven't even mentioned that there was a COVID-19 committee that was led by one of the former members of the board. And I don't want to, is it Dr. Richards? I don't want to get his name wrong, forgive me.
Reed Tuckson.
Reed Tuckson, Dr. Tuckson.
Yes, thank you. I don't know where I got Richards from. And you know, he played a pivotal role in bringing people together. You know, they used some of the data that we collected in terms of the initiative. They held town hall meetings with the various communities in DC trying to attract people. And so that effort really digged into the community to try to get people to become more aware of COVID-19. I would say in terms of the research that I've been personally engaged in with my colleagues, that we've discovered that people are aware of COVID-19. We're doing the best we can as Black and brown communities to cope with it. There's some studies out there report that we're less likely to clean our hands, this, that, and the other. Don't believe that. We all know that culturally we are more likely to clean our hands. It's just how they're asking the question. If you ask somebody, are you cleaning your hands more now than before? I clean my hands all the time anyway. Most of us do. I just wanted to say that. That's one of the things that I've read that really gets me all worked up. And that we're doing the best that we can. Unfortunately, we were suffering the most. As you know, we tend to, unfortunately, because of our socioeconomic positions in this society, but we are doing the best we can. And as Billi mentioned, you know, we have a long history of striving through difficult situations, and we'll make it through. I'm hoping that we can continue to collect data as an initiative, and that Dean Williams will support that, as well as the provost, so that we can get important information to some of you who are on the panel with the work that you do.
Mm-hmm. Billi, if you wouldn't mind, can you respond to that question live for us?
Certainly. The economic impact of COVID is the section that we begin to address things like frontline workers. There was information that in the report about people like bus drivers. So each different state has a different, different numbers on how many people are Black in a particular work field. So the number of bus drivers who are African American in Washington, DC is different than the number of bus drivers who are African American in Utah, for example. And so it was interesting as a person who was looking over the report and putting information together for the public, it was helpful for me to be able to try and synthesize the information rather than find the first resources. We were kind of looking at secondary and tertiary resources to be able to understand the impact. But yes, the question that was posed was, let me just reread the question. I'm just going to pull it up real quick. Was it acknowledged within the research that Black and Latinx people were frontline staff and many contribute to the high numbers of COVID diagnosis? So yes, in the economic section of the white paper, the issue of the frontline staff was addressed. So like people like bus drivers, people like who work in hospitals nationwide were more likely to be African Americans, people who, there were specific jobs. Hold on, I'm gonna try and pull it up for you again. But yes, and then also other things like comorbidity, other things like 50%, I'm pulling it up, isolation. All the other issues also had an impact. So that wasn't the only reason, but that was definitely one of the reasons that African Americans were being infected by COVID at a higher rate and dying from COVID at a higher rate than other races and nationalities.
Okay.
Decarceration. Anyway, it's in the economic section. That's the answer to the question.
Awesome, awesome. Dr. Williams, I want to come back to you with a number of your colleagues. Sorry? Ms. Wilkerson, you had a follow-on statement, I'm sorry? No, okay. So Dr. Williams, I want to come back with you in terms of your colleagues who are actually doing research. Can you just talk a little bit more about the different projects that are ongoing?
we'll try to represent them as best as possible. So I can mention that we have looked at some of the medical treatments. So some of the early treatments that came out, and the way these work, you know, every site doesn't focus on every treatment, but we have looked at a few of those. One specifically wanted to look at how to prevent people from ending up in the ICU once they presented to a hospital. So that was one study. One that is important that actually hasn't started yet, and details are definitely forthcoming, is on the vaccine. I think I mentioned that. So Howard will be participating in a vaccine study. And we're looking very carefully at every aspect of how that is done, and how people are engaged, and our clear messages: make an informed choice for yourself about research participation, and if a vaccine is eventually approved, about whether it is right for you and your circumstance. But the critical piece there is informed. Make sure that you have the information and don't just go on the basis of a few social media posts that you may have seen. And we want to make sure that people have that information so that they can make their own choices.
Mm-hmm. Awesome.
Could I ask a quick question about that?
Sure, go ahead.
So, Dr. Williams, how does that work? If you participate, you would receive the vaccine and you would be tracked to see either you get the vaccine or you don't, but it's not like you're exposed to the virus.
Right.
Okay.
Yes, so that's called I believe, and Dr. Ettienne and McCants can correct me, I believe that's called a challenge study, and that's not being done. That's not considered ethical practice to actually intentionally expose someone to COVID. So the way it's done is that you get the vaccine and you go about your daily life, and they're looking to see within, you know, the way that people normally move about in their worlds, who is more likely to then have a diagnosis. And if you see fewer among those who got the active vaccine, which they wouldn't know at the time until the study was open, that data was open to view, then we could see that if it did have an effect. But no, there is no challenge where anyone is intentionally exposed to COVID, and definitely not intentionally injected with COVID.
Thank you.
Awesome. You know, I'm also familiar with some student work looking at, you know, minority participation in clinical trials. I'm not completely at liberty to talk in detail about some of it yet because there's some data crunching that's ongoing, but it's rather interesting. And I'm going to pose this question to you, Dr. Adams. What role does emotion play in some of the decisions surrounding this whole process? And being at an institution like Howard, where we are at the forefront and we typically have the pulse of the community and the globe, what do you think, what role does emotion play in all of this?
Well, what's interesting is that research has shown that your emotions play an essential role into all decisions that you make, regardless of it, if I should go to the doctor's now or if I should take out the trash. But in regards to this, I would say definitely your emotions, it's going to play into this, as well as the history that we know about clinical trials, and the African-American community is going to play into this too, as people decide if this is the right thing for me to do or not, I would say. And of course, that's pulling on your emotions as well.
Ms. Wilkerson, you had a question that you were burning to respond to. We can bring you up here, or if you're not ready for that, we can go to Dr. McCants. You're on mute, by the way.
Thank you. I did pull up the citations that were relevant to the earlier question, and so I just wanted to and I was typing it in, but Black workers are overrepresented in the essential services industry, comprising 37.7% of the workforce in these industries. Additionally, Black workers are more likely to work at jobs that require close proximity to others. For example, Black workers make up a disproportionate share of bus drivers and postal workers, two essential fields that require interaction with others. And then it further talks about the risk of unemployment and some of the things that were mentioned previously. But I just wanted to provide slightly more supportive research statistics regarding the prior question.
Awesome. Okay, thank you so much. Dr. McCants, I want to come to you for a second. You have been on the forefront. You know, sometimes you you are a little bit shy to say some of the activities that you have participated in. But as a leader in Washington, D.C., representing Howard University and being so integrally involved in the whole process of the response, talk to us just a little bit about why do you believe pharmacy has been so important to the response?
Well, okay, so I think there has been a couple of things. One, what we realized, or what I think all of the health professionals realized, is that pharmacists have already knew is that pharmacists are the most accessible healthcare professional. We probably see patients more than any other healthcare professional just by the sheer nature of our business. And this is particularly for community pharmacists. So when people were looking for someone to ask about COVID, they went straight to the pharmacist. You know, conversations were happening in the pharmacies, you know, when people were asking what they should do about it, how afraid should they be. And it also caused for some pharmacies to participate in testing initiatives very early in the response. And I think that it highlighted that pharmacists' ability to pivot and be able to respond to the community's needs. I also think that other healthcare professionals, and especially in my experience with our interdisciplinary site, testing site, is that I think that other healthcare professionals also realized now more than ever how important it is and how easy it is to collaboratively work with the pharmacist. I think a lot of times, you know, we don't do a good enough job as healthcare professionals of understanding each other's role in the healthcare team. And when being thrown into the pandemic, we all had to take a step back and figure out, okay, well, we need everybody's help at this point. So how can a doctor help? How can a nurse help? How can a social worker help? How can a pharmacist help? How can a dentist help? And I think the pandemic has allowed for us to really realize what we all bring to the table as healthcare professionals in the interdisciplinary team.
So if I can hear you and repeat or give a synopsis of what you're saying, pharmacists being the most accessible healthcare professional has proven that working collaboratively improve the outcome of the patients. And we should then now step up and use the pandemic as an opportunity to come together rather than looking to work within silos. So COVID-19, while it may be devastating, it basically exposed a lot of the wounds that may have been there or have been there, and allow us as an institution to really craft a response.
Mm-hmm.
I would be remiss if I did not commend the administration of the university for its response publicly to the whole COVID-19 pandemic. I think Howard has been on the forefront in the news, both in print, radio, and on television, speaking positively and taking a very tough topic and making it real. I am proud to be associated with the institution at this time in its trajectory, because we've seen leadership that is second to none. So I would put that out there. If we can take just a couple minutes, our time is coming close to that point. So if I can just go back around the room and get a closing statement from each person, beginning with Ms. Wilkerson.
I just wanted to let you know that I really do appreciate the opportunity to participate in this panel. It's my first time being on a panel since I am a lawyer now. So I just wanted to say how much I appreciate the fact that we are all doing everything that we can to work through the pandemic and change things for the better. So thank you all so much for allowing me to participate.
Okay, Dr. Adams?
I would just say that I appreciate this opportunity to participate on the panel, and I'm very grateful to be a faculty member of Howard University. I always say that it's a safe place particularly at a time like this, you know that we are taken care of. And we just want to tell our alumni who are joining us that, you know, continue to do all the good work that you do. Know that we appreciate you as well, and that we will get through this.
Indeed. Dr. Williams.
Sure, my comments will take two paths. Building off of Ms. Wilkerson's comments, that although the circumstances have been unfortunate, as I said in my opening, it really has provided avenues, pathways, and platforms for us to really bring out every skill set, every capacity that we have, and bring it to bear on this problem. And I'm exceptionally proud to be affiliated with the institution. I'd be remiss if I didn't point out I'm wearing my pink ribbon today as a representative of our cancer center. And in dealing with that situation with our patients, one thing that we did was we knew that our patients experienced food insecurity. We had known that for a while, but what we did, because of the limited resources, we actually opened our own pantry so that now we can provide food resources for patients. And it says that that's something that we needed all along, and that's something that we can continue to do. So we're building out new capacities as a result of this response. And my other point I want to make sure to make is that Howard is being called upon nationally to inform the response beyond COVID, so that we don't, the next time there is an international crisis, we don't have to have these same conversations about inequities, disparities, and injustice. And Howard is being called upon to lead those conversations.
Thank you. Dr. McCants.
Mm-hmm. And I think that the Andrew Rivers, who was participating, just read my mind, because I wanted to remind everyone of the definition of the Mecca. And I think what President Frederick has done under his leadership, we have all reminded the world that Howard University is the Mecca. And it is a place regarded as a center for a specific group of people or interest, activity or interest. And so I think that what we have done in the pandemic is, quoting the great Kanye West, is turn tragedy to triumph. And I look forward to continuing to, as Billi said, continuing to be a part of the legacy that is Howard University. And alumni of Howard University, I hope that you are very proud of what we have been able to be done. And as a faculty member, that's what we strive to do. We strive to continue to build upon the legacy that is Howard University. And we are very grateful for the opportunity. And thank you all so much for having me today.
Thank you. Thank you to the wonderful panel. Ladies and gentlemen, I was recently asked a question about leadership. A colleague of mine asked me to define leadership. And my response at the time was twofold. I started looking for all sort of, philosophical ways to define leadership. And then I landed on a statement that was made by a mentor of mine. Leadership is influence. Howard University, its faculty, the administration, the leadership of the university, Dr. Frederick and Dr. Wuja, epitomize leadership. Howard University's influence on this pandemic has been palpable. Our faculty and staff, our students' response on the front line has been palpable. We have at the forefront individuals who bleed Howard blue. We represent a group of people who are truly socially conscious and want nothing more than the advancement of our community. Howard Forward, we stand here ready, willing, and able to lead. Thank you, ladies and gentlemen, for participating in this panel. We really appreciate the questions that have come forward. Feel free to reach out to any one of the individuals on the panel via the emails on campus if there are additional questions that may be raised, or if there are additional questions that you want to have answered. I thank you for the opportunity to moderate and be part of this really auspicious group. You guys have been wonderful. Have an awesome day.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Thank you.
Thank you again, you guys. Have a beautiful day.